I've never taught my students anything. I just try to put them in the best conditions to learn. Albert Einstein. Ladies and gentlemen, welcome to the Knowledge Path Agenda 2021, an initiative by Diapath Knowledge Academy. Diapath is a leading company offering a complete range of innovative instruments, reagents and consumables for anatomic pathology. Diapath Knowledge Academy offers educational webinars dedicated to lab scientists, anatomic pathology professionals, anatomopathologists and students. We are glad to introduce you our teacher, Dr. Antonella Savio. Dr. Antonella Savio has been working as a histopathologist for over 30 years in 5 different hospitals in Italy and UK. She will later introduce herself. Thank you very much for the precious cooperation. As you know, Diapath is approved CE use provider by NSH, National Society for Histotechnology. If you're interested in gaining CEUs by NSH, you're welcome. You're invited to follow the instructions under the website www.diapath.com/webinars-list. Before starting the webinar, just a few practical information. The webinar is about 30 minutes. Then we are going to have a question and answer session at the very end of the webinar. So you are kindly invited to have your questions at the very end, typing the questions in the chat for the final open discussion. Thank you. Now, let's start with the webinar. The journey towards quality in histopathology.
Here we are with this second webinar, The Journey Towards Quality in Histopathology. Today, the general concepts on quality in histopathology departments are explained together with the strategies to pursue continuous quality improvement. Special attention will be given to specimens reception and traceability. What does quality mean in histopathology? Quality means different things to the different professionals working in the histopathology department, to the patient and to the requesting physician. To the lab scientist, quality is the production of high-quality sections or slides. To the consultant pathologist, quality means accurate, timely and complete reports. To the clinician, quality is timely reports useful for the management of the patients. And finally, for the patient, quality is getting the right medical treatment in the shortest possible time. For the histopathology laboratory, quality control must be seen as the policies, practices and procedures enshrined for the production of high-quality sections and of accurate, timely and complete reports in a cost-effective and safe manner at all times. Histopathology is pivotal to healthcare. To obtain the optimal care for the patients, it is really important that a good quality standard is always maintained in histopathology. On the other side, a quality deterioration means the possibility of adverse health events for the patient and might compromise the patient's care. However, measuring and checking the quality in histopathology is complicated. Quality analyses are well established in the departments where numerical data is obtained, like those of clinical biochemistry or hematology, while it is difficult to assess the quality of histopathology laboratories whose reports contain interpretations, explanations, evaluations of probability, and clinical judgment. In fact, histopathology not only is a science, the science by which the image is placed in the context of knowledge of pathology to draw an accurate diagnosis. Histopathology is also an art, the art of analyzing and interpreting the shapes, sizes, and architectural patterns of cells and tissues within a given specific clinical background. Therefore, the assessment and implementation of quality control in histopathology is not easy, as its output is more qualitative than quantitative. An integrated coordination between technical and managerial activities along with highly skilled scientists and pathologists is essential for the continuous realization of high quality, error-free, efficient and effective laboratory operations. To be effective and safe, all the procedures and activities should be evaluated and monitored accurately. The safety of patients, staff and the environment are all important. Healthcare systems should be safe at all levels to prevent errors. The journey towards quality in histopathology starts on specimens reception and concludes on the correct and timely diagnosis, allowing optimal patient management. High-quality diagnostics starts with high-quality tissue specimens, which involves many different procedures, most of which are still based on manual work and have remained relatively unchanged over the last century. To ensure the quality performance, every laboratory should have some form of quality management system for all the procedures performed under its scope of activity. A project for quality management is divided into 3 different processes. Quality control, which consists of intercepting and trying to minimize errors. Quality assurance, which involves planning a series of scheduled review activities to ensure that reports are accurate and reliable. These include internal and external quality controls. Internal quality assurance consists of comparing the results of internal assessments, for example, the result of the final histological examination with that of a previous frozen section, or the findings of the actual histology with those of a cytology or of a previous histology. The external quality assurance is organized and guaranteed in some countries, like in the UK and USA, by nationally organized external quality assessment programs. It can also be organized with inter-laboratory controls. Quality assurance also implies the use of inspections and audits to assure the compliance with the standards of international accreditation bodies such as ISO 9001. The objective of continuing quality improvement is instead trying to identify any possible opportunity to improve the quality through the analysis of all the processes that take place in the laboratory to find out the possible sources of problems or errors before they can happen. A very important point to be noticed is that in this slide describing the quality management, the word errors appears twice. In fact, the recognition of error plays a key role in addressing any process towards quality, especially if you are dealing with the health and life of people. Being aware of the importance of declaring, registering, analyzing errors and find a way to avoid their occurrence in the future is a critical first step to improvement. No one is error-free. Where people work, mistakes are made. Hiding mistakes has the only consequence that the same mistakes could easily recur in the future. I have started working in a time when errors tended to be covered. I have thereafter learned how it is important relying on the culture of error used as a resource for improvement. In my experience, there are still places that are far from developing a real open error management culture in which mistakes become something to share rather than hide, an occasion to learn from them, a precious resource to improve quality, to demonstrate it, to obtain additional instruments as well. In the last years, the practice of incident reporting has been encouraged or made compulsory. However, in my experience, this powerful instrument is still underused and incorrectly perceived. In the absence of a culture of error, When you share your mistakes with the aim of avoiding that other persons can repeat the same error, you risk to appear as the only fallible person amongst perfect, infallible professionals. As a consultant, when you complete an incident reporting or try to investigate what went wrong in the lab, you are frequently misunderstood and give the impression of being looking for a culprit rather than aiming for the improvement of a production process. In many places, you will never know who did what or why something happened. This way, tracking and addressing problems is hindered. In order to create an error management culture, it is important to start dealing with this on the organization level instead of at a level of individual workers. Structure and culture have to be well aligned. The conduct and reactions of managers are crucial for how errors are regarded. A transparent error management culture directed at remediation and prevention works the best in both the short and the long term. Quality involves continuous effort and surveillance, innovation and adaptability, attention to detail and overall view. Rather than a sequence of set rules, it represents a continuous process that involves all the activities in a histopathology laboratory, from sample reception to report delivery. Designing a quality control and an assurance plan in histopathology should focus on three phases: pre-analytical, analytical and post-analytical. Errors at any of these three stages can lead to serious misdiagnosis. The accuracy of the final diagnosis is a measure of the effectiveness of many pre-analytical elements, including specimen collection, transport, dissection, tissue processing, embedding, sectioning and staining. I have put in bold the most frequent sources of errors that need to be carefully targeted. The analytical phase is related to slight reading in the context of relevant data and preparation of the report. The assessment of this phase is difficult because of the subjectivity of the reports. However, there are many ways to improve the quality of the reports, including intra-departmental discussions, comparison with other reports, either frozen or cytology or histology, random blinded case review, external consultations and review by experts, adherence to guidelines, reporting protocols and staging systems is especially important for oncology specimens reporting. The post-analytical phase involves the activities that follow the preparation of the diagnostic report, including checking and amending typographical errors, formatting and delivery of the report, archiving of request forms and reports, storage of the reported specimens for set retention period, and safe disposal of residual specimens thereafter. Research has shown that most laboratory errors take place in the pre-analytical stage. This should be kept in mind. Patient or specimen identification is one of the most important aspects, and it starts with specimens labeling and accessioning. If the reception and processing unit is not properly organized, the integrity of the complete analytical process is at risk. It is therefore crucial that all the procedures of sample reception are made clear with an SOP and are followed meticulously to prevent further processing of and interpretation of specimens with potential mismatches. It is very important to endorse definitive specimen rejection policies in any laboratory. These policies should be written in clearly displayed documents in order for all the staff to become aware of them. Without precisely following the correct procedures in the sample reception and processing stage, the traceability of the sample is not guaranteed, the quality of results is not assured, and the health of patients is put at risk. This standard operating procedure should include instructions for checking sample integrity and deciding if the sample is accepted or rejected, it is important to establish clear acceptance or rejections criteria and refer to them, to develop a procedure and a form for sample rejection. The criteria for acceptance should include correct container of the sample, presence of fixative, appropriateness and volume of fixative, a time frame for acceptance, the completeness of the data on the request form, concordance of the request form details with the sample details. It should include instructions for introduction of the accepted samples into the laboratory register, sample labeling at the time when it is introduced in the register, sample processing, the review of requests and the decision of which procedure must be performed, for example, if opening the specimen or decalcification is needed, or no further fixation and grossing is necessary. Establish, whenever possible, in your SOP, a special procedure for urgent samples so that they can be easily recognized and prioritized. As an example, you could use a special color, let's say yellow, to establish a yellow track with a yellow sticker on a request form, yellow cassettes and slides with a yellow band, so that urgent cases were easily recognized by their color at each step. Sample labeling and registration is the first step to create traceability. Sample portions are made traceable to the primary sample by using the same label on all the portions. Moreover, the sample is also connected through the label to the form and the register. This, in turn, ensures that all the relevant information about this sample is properly recorded, enabling the possibility to verify the results and perform other quality controls. A sample register should include at least the following details. It can be maintained on paper, but it is strongly recommended to use an electronic system. The simplest electronic form is an Excel sheet. However, this is sensitive to making mistakes, such as transcription errors. A laboratory information system, a LIS, a software package dedicated to the lab, is the optimal solution. There are many different options on the market. Many are the advantages of using these systems. They can provide a lot more control and oversight of performance of the laboratory and are more error-proof. Using a LIS means principally less errors and less time spent. Less errors due to transcriptions of numbers and names on cassettes, slides, reports, which means more safety. Less time spent on introduction of data, checking a sample processing phase, retrieval of all cases. It implies a significant advantage for the patient, including for the pathologist easy access to the results of all exams requested and information provided, such as family and personal history, previous surgery, previous treatments, possibly linked to the actual sample. A combination of results may pinpoint characteristics of a specific problem, like a genetical or acquired predisposition to specific types of tumors that can be prevented, which you would miss if you only see single results on specific exams. And it implies a significant advantage for the lab, which is more control, easy access to the relevant data. For example, the percentage of events in which the turnaround time was exceeded, investigate the rate for specific tests. This is a parameter that is highly important for planning the acquisition of reagents, or the rate of positivity of a specific stain, which means the reliability of the method reagent used. Using a LIS increases the possibility of research. You can find out a list of similar cases using specific codes or keywords. A LIS could be used to connect only limited stages of the production process. It could be used only as a database to register the patients at the entrance, to produce printed cassettes and printed labels for the stained slides, to type and register the diagnosis, to type and record SOPs. This use only allows a very limited control over the consistency of the data at registration with those of the diagnosis, and basically corresponds to using it as a word processing software. It provides very little and rudimentary tracking. It fails to report data in such a way as to be useful in real-time decision-making. This becomes evident when trying to find a missing block or slide, or when you try to investigate on the progress status of a specific sample. Moreover, it leaves unaltered many weak points where errors can easily take place. A classic example is the phase illustrated in this picture, where checking the data on the pre-printed cassettes, containers and forms received before proceeding to grossing is just relying on human attention. Most of the phases along the way from the reception of a specimen to the delivery of its report can be interconnected, tracked and put under the control of a LIS. A very important point to be addressed is represented by the choice of the instruments. It is very important to choose instruments that can work in series with no need of manual intervention in between. Most of the instruments in use today have a good degree of technology. They have controls and indicator lights, but are still frequently not interconnected. They each work on their own and may be used in compatible baskets, hence the need for the technician to move the slides from one rack to another one. When the technician's job is that of moving the slides or the cassettes from one rack to another, this is inefficient, implies the risk of mismatching samples, and represents a very bad use of the time and added value of the scientist's work. Similarly, it is inefficient and a waste of precious time when the lab scientist loads an instrument removing exhausted liquids and adding new ones, when prepares dilutions, not to talk about staff safety. Some of the new generation instruments are designed to adapt to different racks. It is very important to consider this detail when evaluating a new device to be installed in a laboratory. It is highly relevant from the point of view of quality that our instruments can be integrated into the LIS. Most of our instruments now have become interfaceable to the LIS, allowing the control of many manual functions with considerable advantages in terms of patient safety. If our instruments are not integrated into the LIS, this means that no data about their productivity is easily accessible. How many days per year is an instrument out of use? How often does it break? Why? Was it due to a human error, or was it a mere technological problem? In order to know all this information about any single instrument, you need to keep a series of paper records, the compilation of which takes up precious time. Anatomic pathology has historically relied on manual systems of tracking and data collection. One of the major revolutions in healthcare has been the use of barcodes. A barcode is a method of representing data in a machine-readable visual form that can be read by special optical scanners. Barcoding is now recommended as an evidence-based best practice. Barcodes have been used in many areas of healthcare, including the blood bank, pharmacy, medical records, materials management. Barcoding has been used in the clinical pathology laboratory for decades. Barcode-based tracking systems have made their appearance in surgical pathology laboratories only about 10 years ago. Tracking begins with associating each asset to be tracked with a machine-readable identifier, typically represented by a barcode. Trackable assets in the histopathology laboratory include request forms, patient specimens and their derivatives such as tissue blocks and glass slides. Barcodes allow rapid, accurate entry of an asset identifier into a tracking system, recording the person doing the scanning, the date and time, and potentially the location at which the asset was scanned. When scanning is associated with a change in asset status, for example marking a block as cut, the asset can be tracked through its production and use in the laboratory. The introduction of barcodes in histopathology was of a limited value when linear one-dimensional barcodes only were available, representing data by varying the widths and web spacings of parallel lines based on the Morse code. It is since it has become possible to reproduce barcodes on plastic and glass, on cassettes and slides, that the barcodes have acquired great importance. This became possible using matrix barcodes or 2D barcodes or QR barcodes, in which the data are represented by geometrical figures, square dots, rectangles, hexagons. 2D barcodes allow to encode more characters within smaller barcodes. 50 characters can be contained in 2 to 3 square millimeters. They allow omnidirectional scanning and result in fewer scan and printer failures. 2D barcodes can be marked directly onto components with various methods, commonly industrial inkjet, dot pen marking, laser marking, and electrolytic chemical etching. These methods give a permanent mark which can last up to the lifetime of the component and can be read using purpose-built 2D optical scanners. This is the innovation that has opened up the possibility for a real tracking in histopathology. The tracking technology also offers radio frequency identification tags. These are small electronic devices that can be affixed to assets, can store unique codes or characters about that asset. They are similar to barcodes, but do not necessarily require a user to physically locate and scan the tag, as radiofrequency identification readers scan tags by using radiofrequency signals. Currently, radiofrequency identification technology is more expensive than barcodes, and there are limited vendors offering complete anatomic pathology tracking solutions. Scanning assets is not only easier and more accurate than manual key entry, but automatically captures data directly into the LIS that can therefore be analyzed as part of an overall quality management program. All steps of the histology process that involve manual labeling have been eliminated and are now automated. The cases are accessioned into the LIS where a case number is generated, and specimen labels and cassettes are automatically printed. At grossing, each cassette is visually confirmed to match when the specimen is dissected and is registered within processing racks. Once processed, the tissue cassettes are scanned at the embedding station. Each block is scanned just prior to sectioning and produces its own. Slides are then scanned before being distributed to the assigned pathologists. In turn, the pathologist scans the slides before placing them under the microscope. When the whole path is traceable from sample recognition to microscopic examination, this really changes the way of working. There are several good reasons to implement tracking. One of the major advantages of a tracking system is its ability to help eliminate labeling errors and maintain optimal patient safety. Errors from misidentification in the laboratory may result in an adverse event that causes serious harm to the patient. Tracking data can be used to locate the history of any asset, making it possible to investigate any problems associated with its production or use. It can provide up-to-the-minute information about the current status of an asset. Moreover, tracking assets in the laboratory can provide real-time detection of workflow bottlenecks. Tracking helps maximizing workflow efficiency. Laboratories are increasingly trying to improve their turnaround time while coping with increasing test volumes, fewer staff, and more complex cases in testing. With a tracking system in place, time-consuming labeling and manual checking, searching is avoided. The productivity of any phase can also be measured and monitored. the comparison of alternative strategies is possible. Other potential reasons for a laboratory to implement a tracking system may include improved logistics, for example, a better management of reagents inventory or archived cassettes and slides. But tracking can also make memorizing and recalling possible. For example, you can recall the exact position of a tissue block when the last slide was cut on a specific microtome, avoiding loss of tissue, which is especially important when dealing with small biopsy specimens needing further sections for additional investigations. Tracking of specimens, blocks and slides promotes patient safety and can enhance the efficiency of the entire laboratory. In other words, it improves quality. In this paper, the experience of several different laboratories is reported, confirming the dramatic decrease in rates of overall misidentification cases, 62%, slide misidentification defects, 92%, and 125% increase in technical throughput at their microtomy workstations obtained by the introduction of a barcode-based tracking system. But implementing tracking is not as simple as installing a software and turning it on. Interoperability is essential for tracking in a laboratory, not just with assets and the LIS, but also with instruments to be used, including printers, autostainers, and so on. When considering introducing a tracking system, a laboratory should certainly consider the characteristics of its LIS. If a tracking module is not already integrated with it, the option is to add a middleware, a software designed to enable communication between different softwares and management of data. Additional costs also need to be considered, including barcode readers and additional computers and monitors. The staff might also find it difficult to adapt. In fact, tracking will require significant changes in workflow and an overall change in the culture of the laboratory. Preparation, training, commitment, and accountability of the people involved are crucial to the success of this process. In conclusion, people, not technology, are the key to assuring quality. Thank you for listening.
I'm very glad to invite you to the next webinar, the PreAnalytical Quality in Histopathology, which is due on the 11th of March 2021 at 10 a.m. or 4 p.m. CET. You're welcome. Subscribe under www.diapath.com/webinars-list.